Now, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. In this segment, a quick segment, what I'm going to show you is a lot of things. One, how tumor necrosis factor receptor binds to tumor necrosis factor. And a lot of tumor necrosis factor anti-inflammatory agents actually creates a blockade between tumor necrosis factor and tumor necrosis factor receptor. The reason this is so important because through two pathways, this is the MAP kinase, but this is actually called TAK1, these are, and by the way, mitogen activating protein is MAP. So all of these from left to right are considered MAPKK. So then ARAF, BRAF, and CRAF. And then they give rise to, depending on which pathway, for instance, here under tumor necrosis factor, this goes to MKK36 and then P38, and then goes in and then causes AP1. And all of these are causing downstream from here to here. All of them are causing inflammation, apoptosis, growth, and differentiation. So as you see, inflammation is a very important part of this. And this is coming all the way deep from the nucleus. So if some way we can stop these also toll-like receptors here, and then growth factor receptors here, and here's another receptor where stress plays a factor, and then the PAMPs. All of these lead to higher inflammation rates, and so if we can blockade some of these extra ones, then that would be better. So I wanted to bring to your attention NF-FK beta because there's some receptors that actually block this. As you can see, this is causing inflammation, so there's actually some drugs down the pipeline that attach to this and block it. That, in a nutshell, is how inflammation takes place within a cell. Thank you for listening. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy, and I wanted to create a separate video from the explanation for MAP kinases to show you what types of, how it activates inflammation. And I kind of told you already in the other video about how it goes through and causes havoc, but inflammation is characterized by 5 fundamental symptoms: redness, swelling, heat, pain, and loss of tissue function, which results in an increased permeability of the vascular endothelium, which as well as extravasations of immune cells. So macrophages and dendritic cells are the central player in innate immunity. However, epithelial cells, endothelial cells, and fibroblasts also take part in innate immunity. So innate immunity and adaptive immunity are both important to understand in the context of inflammatory disease. So damaged cells releases endogenous molecules called as damage-associated molecular patterns, DAMPs, which are also recognized by PR. So these are a lot of these receptors that I was telling you about within the diagram, but these 5 fundamental symptoms are really important to know as it pertains to inflammation. So this article goes through and kind of gives you an understanding of some of these receptors and mitogen activated protein kinases, which gives called which were initially called as extracellular signal-regulated kinases. So it causes a general cascade of activation that then goes into the nucleus and causes differential expression of some of the genes. I'm not going to go over this diagram because I went over this already. And here's some additional MAP kinases, which actually is the same one from the diagram. So this article is quite informative in the fact that it has a diagram and also a lot of the different MAP kinases, how it works, and even stress causes inflammation. This shows that clear connection. Thank you for listening.